Number 7. Celso Sanaban. Celso Sanaban craved the unattainable, the ageless, flawless beauty of Barbie kin born in Brazil. Celso's obsession with the plastic figurine began at the tender age of 16 when friends remarked on his uncanny resemblance to the doll. From that moment, Celso embarked on a transformative journey that would ultimately consume his life. Determined to perfect his K-like appearance, Celso invested a staggering $50,000 into cosmetic procedures. He underwent a series of surgeries to reshape his nose, chin, and jaw, all in the pursuit of achieving the chiseled features that define Kin's trademark look. Silicone implants were inserted to contour his face, while his skin was subjected to a myriad of treatments to maintain its youthful glow. As Celso's physical transformation progressed, so did his fame. He became a viral sensation, with his photos garnering thousands of likes and followers on social media platforms. Kilo even launched his own line of Celso dolls, capitalizing on his newfound celebrity status. However, just 5 months after completing his metamorphosis into a living, breathing Kin doll, tragedy struck. Celso was diagnosed with leukemia, a rare blood cancer that severely weakened his immune system. This, combined with previous complications from hydrogel filler injections, made him vulnerable, and he soon contracted pneumonia. Despite his youth and seemingly perfect exterior, his body couldn't fight off the illness. He passed away at the age of 21. Number 6. Carol Bryan. Cosmetic procedures offer the promise of enhancement, but even the most routine interventions can spiral into unimaginable disaster. In 2009, Carol Bryan, a vibrant and successful woman, decided to undergo a seemingly low-risk procedure to smooth out a few wrinkles and restore volume to her face. Little did she know that this decision would forever change the course of her life. The procedure, which involved injecting fillers into Carol's face, took a disastrous turn when the doctor mistakenly mixed two incompatible substances. The error caused an immediate reaction, leaving Carol's face swollen, bruised, and in excruciating pain. As the days turned into weeks, it became clear that the damage was far more extensive than anyone could have anticipated. Carol's skin began to deteriorate, taking on a hard, lumpy appearance. The once soft and supple contours of her face were replaced by a disfigured mask that bore little resemblance to her former self. The physical pain was compounded by the emotional trauma of losing her identity and the life she had once known. In a cruel twist of fate, Carol also lost sight in one of her eyes due to the botched procedure. The fillers had migrated, putting pressure on her optic nerve and causing irreversible damage. Now it's time for today's subscriber pick. Plastic surgery is pervasive in the fashion and modeling world. Many individuals undergo procedures, often keeping them private. Sometimes dramatic changes in appearance, like looking younger or completely different, can raise suspicions. However, these procedures can have disastrous consequences. This was the case with a Russian model, reportedly successful with lucrative brand deals and runway appearances. Her relentless pursuit of an ideal look led her down a path of over 20 procedures. While most went well, a quest for further perfection resulted in botched cheek and lip enhancements that left her unrecognizable and ultimately cost her career. What are your thoughts on this and the rising popularity of cosmetic surgery? Let us know in the comments. Number 5. Tara Reid. Tara Reid, the vivacious starlet who shot to fame with her roles in iconic films like American Pie and Van Wilder, found herself at the center of a media firestorm form when her pursuit of physical perfection took a disastrous turn in 2004. At the height of her career, Tara made the fateful decision to undergo a dual procedure: breast implants and body contouring. The surgeries, which promised to enhance her already enviable figure, instead left her body a mangled mess. The breast implants were poorly placed, resulting in a visibly uneven and distorted appearance. The body contouring, meant to sculpt and streamline her frame, instead left her skin rippled and puckered like a piece of fabric that had been carelessly bunched and sewn. As pictures of Tara's botched surgeries hit the tabloids, the young actress found herself at the center of a media circus. Her once promising career took a nose dive as directors and producers shied away from casting her in leading roles. The woman who had once been hailed as a rising star saw her professional life crumble before her eyes. But Tara's ordeal was not just career setbacks and public humiliation. The physical and emotional toll of the botched surgeries was immense. She found herself grappling with chronic pain, infections, and a shattered sense of self-worth. The woman who had once exuded confidence and charm now struggled to recognize the reflections staring back at her in the mirror. Number 4. Donatella Versace. Donatella Versace, the iconic fashion designer and sister of the late Gianni Versace, is known for her platinum blonde hair, bold fashioned choices, and her ever-youthful appearance. However, her seemingly ageless appearance has been the subject of much speculation and criticism over the years. Versace has never confirmed the extent of her plastic surgeries, but experts in the field have pointed out several telltale signs of cosmetic work. Her skin appears unnaturally smooth and taut with no visible wrinkles or fine lines. Her cheeks are also notably plump and her lips appear fuller than in her younger years. Some have speculated that Versace has undergone multiple facelifts and Botox injections and fillers to maintain her youthful appearance. Others have suggested she may have had a nose job and even a possible brow lift. While Versace's transformation may be seen as a success story in the fashion world, where youth and beauty are highly prized, others have criticized her for promoting unrealistic beauty standards and setting a dangerous precedent for young women. Number 3. Mickey Rowe. Mickey Rowe's career took off in the 1980s with his roles in films like 9½ Weeks and Angel Heart, where his rugged good looks and bad boy charm made him a sought-after leading man. However, Rowe's foray into professional boxing in the early 1990s left him with significant facial injuries, including a broken nose, cheekbone, and split tongue. In an attempt to repair the damage, Rowe underwent a series of reconstructive surgeries. Unfortunately, the results were far from what he had hoped for. Rowe's post-surgery appearance was drastically different from his former self. His once chiseled features were replaced with a puffy, almost unrecognizable face. The actor has been open about his dissatisfaction with the results, even going so far as to say that he went to the wrong guy to put his face back together. Despite the drastic change in his appearance, Rowe has continued to work in Hollywood, embracing his new look in films like The Wrestler and Sin City. He has also been an outspoken critic of the pressure actors face to maintain a youthful appearance, urging others to learn from his mistakes. Number 2. Laura Ayla. In October 2018, Laura Ayla, a 36-year-old real estate agent residing in Dallas, Texas, ventured southward to Mexico, her destination a clinic in Ciudad Juarez, where she had scheduled a nose job and breast augmentation. Little did she know this seemingly ordinary venture would soon spiral into an unimaginable ordeal. During the administration of anesthesia, something went horribly wrong and Ayla suffered severe brain damage. She was left in a coma and was eventually transferred to a hospital in El Paso, Texas, where doctors discovered that she had suffered multiple cardiac arrests and had been without oxygen for an extended period. Despite undergoing multiple surgeries and receiving round-the-clock care, Ayla never regained consciousness. Her family made the devastating decision to remove her from life support, and she passed away on November 24, 2018, just days before her 37th birthday. While the allure of cheaper prices and faster wait times can be tempting, the reality is that many facilities abroad operate with lower standards of care and regulation than those in the United States. In Ayla's case, the clinic where she